Whenever I see a patient comes in with neck pain and or arm pain, I want to sort of break it down. Are they having more neck pain problems or are they having more arm pain problems? Arm pain for me starts somewhere in the shoulder, radiates down in the upper arm, forearm, hand. Neck pain is more sort of midline, axial neck pain. Trapezial pain, somewhere in the middle. Okay? In general, if it's more arm pain, I know it's nerve-related, radicular-related, and we'll talk about that in a couple more slides. But that sort of engenders down a different treatment pathway or treatment algorithm than axial neck pain. Axial neck pain often is just thought of as degeneration in the disc, wear and tear, arthritis in the facet joints, but some joint problem as opposed to a nerve root compression problem.
So the history and physical exam, how do we determine, first of all, our first question is it spine or not spine? And is it a confounding factor that's causing the person pain? It might even be their spine. So how do we determine that? So when we examine their back. Are they tender? How's their range of motion? One of the big tests for us that not a lot of people do is a single leg extension. So stand on one leg and lean back, stand on the other leg and lean back. It loads your posterior elements asymmetrically. If it causes pain, that a lot of times is indicative of a pars fracture or a spondylolysis, a stress fracture in the bone. And we see that especially a lot in young adolescents and 20-year-olds, especially athletes. Examining the hips, you got to differentiate, is it a hip problem or a spine problem? Because a lot of people have a bit of both, especially as they get older. And so what's the range of motion of their hips? Are they tender at their greater trochanter bursa? That's often a sort of, when people say I can't lay on that side because it causes pain. Well, that's not really a spine problem. That's a lot of times a bursa problem. Their greater trochanteric bursa, you'll touch them and they're tender as heck. I inject it and it takes away their pain. It has nothing to do with their spine. And then a Faber test, which is the flexion, abduction, external rotation, like this, with your leg. If that causes groin pain, anterior groin pain, that's a hip problem, not a spine problem.